Hello, everyone. Welcome back again to my second edition with Dr. Richard Dow. I'm honored and humble, and it's a privilege to get to know Dr. Richard Dow. He's been on my podcast a few months ago, and now he's back for more. I'm honored to have him on the podcast today. I'll be getting to get to know more about Dr. Dow on personal level. And Dr. Dow, just want to thank you for being the show.
Thank you. I enjoy being here and being able to share some of my wisdom from many years of practice.
Wonderful.
So,
Just to quickly, for those of you who haven't met Dr. Dow's, he's been practicing almost the year that I was born is the year that he's graduated from dental school. So it's been a long 4 decades of his career, and for close to 5 decades, he's a founder of multiple company. OraCare he's a co-founder of OraCare. It's oral rinse medication and a bunch of other material product that on the market for dentists and patients to get to know more. He's the founder of the Dental Chiropractice Collaboration Group Study. He's the founder of the Sleep Talent Academy, and he is the grandparent and the father of 4 children, right, Dr. 2 children and 3 wonderful grandchildren right now.
That's right.
Yes, been married for 53 years. So I look forward to get to have a conversation about the journey that he's this is the journey that of a dentist and a founder, and he never stopped. Even he retired a couple of years, but he's non-stop. Keep thinking, create his mind, use his brain for the best of the rest of his life. Dr. Dow, what's the background in that's a beautiful background.
Thank you very much. I appreciate that. Yeah, I am the co-founder of OraCare Products. That's oracareproducts.com. We make a rinse. Right now, our main seller is this rinse. There's two of them. You can see there's a blue bottle and a white bottle.
Mm-hmm.
When you mix those together, they release an active ingredient called chlorine dioxide, which has been shown to be very effective against controlling not only bad breath, but it activates viruses, kills fungi and bacteria, and it's been producing tremendous results even among cancer centers now. They're ordering the product frequently. I've gotten patients that are reporting great results with benign pemphigus and even lichen planus, and also other types of oral diseases that seem to be inflammatory in nature, like migratory glossitis. So it's been a great product. It's doing more than we thought it would, actually. And during the pandemic, the company actually grew because it's superior antiviral and antibacterial. Matter of fact, we tested it against both types of viruses, the coronavirus 229, which is a COVID surrogate, and then we also tested it against COVID-19 virus in and of itself, and they both had remarkable killing power within 30 seconds. 99.99% was the findings.
Wow, that is impressive. So, can you talk about how did you found the company? How did you?
That company was started about 2012. Actually, I started it. I went to a lecture in the Fortune Management Company with Platinum Circle. I'm a member of the Platinum Circle. They asked me to speak on a subject, and when they asked me to speak, I said, well, I'm going to do a lecture on bad breath. And they started laughing. And I said, well, I think you'll find it very interesting. And I went down there, I went through all the cytokine charts and all the pathways for gum tissue, collagen loss. And I explained to them how this could reverse that and interfere with it. And by the time we were done, I mentioned that we could make a company with this product. And before I got home, I had two people call me. Well, actually, as soon as I got home, I walked into the door from the airport, and two people called, and the two of them together had offered me $400,000 to get started.
Wow.
And then we ran a offer memorandum, and it blew up because a lot of people wanted to invest. And then the nice thing about that is the dentists are also the customers. So we had a built-in customer base. We didn't have to build from scratch. And these were motivated customers because they were invested in the company. So it was a good way to start. If you want advice on building a company in the dental field, make sure your investors are the people that are going to be using your product. Have a built-in customer base and a built-in motivation for continued sales that you can build on.
So it's you said the OraCare had been filed 12 years ago. 12 years ago, you said?
2012. So yeah, 10 years ago.
Wow.
Yeah.
It's amazing. So you did the presentation about the bad breath, and that's where it started.
Yeah,
that's
right.
It's amazing. Like that is something that most dentists are so silent. We don't want to talk about it. And we talk a little bit about that. And we just walk away and just focus on cut the teeth down, build the teeth up, you know,
right.
And then we don't have enough education to really help the patient. We can talk about like yeah, because of this and that, but then whatever product on the market, we just accept it. And but you push yourself to the next level, that you're trying to work with the researcher and developing something that is working. So that is powerful. And where can we find out more about the OraCare?
Just go to OraCareProducts.com.
Okay.
And that would be there's some scientific studies there. You can read about how it works. And I would say too, you'll be able to call me, or if you want to, through my other websites. But I would suggest you do it through OraCare.
Okay. Also, can you talk a little bit about you also have a toothpaste? You mentioned that you going to.
Yeah, we're developing a toothpaste now. It's with another company called NovaFlux. And this is just an experimental jar I'm using at home right now. This has, there has hardly been any change in toothpaste in 75 years. They keep adding stannous fluoride or sodium fluoride, or they add, some calcium to it to, help the teeth. But there's been very, very little changes. This is going to revolutionize. As a matter of fact, in a concentrated form, this can be used as a prophy paste substitute as well. So it will be a really great program for not only the hygienist, but when they send the patient home, they've got something that really cleans the teeth. And it uses Norwegian spruce nanofibers in it, so it doesn't debride the teeth, but it acts like a little fiber sponge. So when you brush with it, it actually goes between the teeth into the embrasures and removes plaque. Matter of fact, they saw the plaque index on patients carrying this to the commercial toothpaste, and the plaque index went from 3 down to 1. Now that's extremely remarkable. And over a period of a month, the plaque levels on your teeth continue to decrease, so that it's almost imperceptible anymore. if you're using a disclosing solution with this to see plaque, you will see a remarkable result. Most plaque indexes reductions are like from 3 to 2.5, and this one was almost 3 times less than normal. So it's pretty remarkable what it does.
That is impressive. That is super awesome and excited for the dental community.
Yeah, it has sodium fluoride in it, so I mean, it's not like we don't put that in there, but
right.
It's going to be a remarkable. Matter of fact, when I brush my teeth in the evening and I wake up in the morning, well, I've noticed that I don't even feel like I have to clean again in the morning. It's just absolutely remarkable what this does.
Do you have any suggestion for those patients and also for dentists when we deal with the patient who have like especially lower anterior? Every time we see them, there's so much plaque. Yeah. They say, "Yeah, I clean," you know. But then after a couple months, even we don't see them. But by the time they come back, it's just so much plaque. And is there any product that you are developing?
We're in the process of a longitudinal study with this product, comparing it to other commercial toothpaste, any of them on the market. Okay. And we believe that because it's removing the plaque so thoroughly, that there's going to be a reduction in calculus as well, because it just won't be able to accumulate. It's not depositing in the plaque substructure. So it's going to be a really good thing. Okay.
Amazing. Amazing. And you also do other things. I know you're very active. You also part of the sleep study group, right?
Okay. Yeah. Well, I'm developing another company for that. It's called USA Guard, USA-Guard, and I'm developing 2 rinses for that for the nose. This is the rinse with a xylitol rinse, and this is the hypochlorous acid rinse. Okay. Now these are in experimental phases right now. We're testing out different formulas, but these will be used together. The first one with the xylitol and the second with the hypochlorous acid. We've noticed that with this 1-2 combination, that we are able to open up the nasal passages for more airflow. And we believe that nasal breathing is extremely important because there's a lot of nitric oxide produced in your sinuses. And by unstuffing those nasal passages, that nitric oxide gets out into your lungs where it's supposed to reduce blood pressure and helps with the just the general circulation in the body. The nitric oxide is extremely important.
So the nitric oxide, did you say that the nitric oxide is being produced by our nasopharyngeal?
It's produced in the sinuses, okay? And there's no bacteria needed for that. Now in the tongue, there is some commensal bacteria that help convert nitrates to nitrites. And nitrites, well, here's what happens. You get a little complex. When you eat like a green leafy vegetable, let's say it's lettuce, and it has a lot of nitrates in it, that's good. You swallow it, and about 25% of that is absorbed from your intestine into your bloodstream, goes back to the mouth and secreted in the saliva, these nitrates, and the saliva goes into the mouth. Then the commensal bacteria on the tongue convert the nitrates to nitrites, nitrites, which is NO2. Then the NO2 is swallowed again, and then the NO2 is absorbed into the bloodstream and acts a lot like nitric oxide, relaxing the blood vessels and lowering blood pressure. Nitrites and nitric oxide do similar things. Nitrites last longer. Nitric oxide is faster and a shorter life. Nitrites are converted into nitric oxide in the tissues. So that's a complex. Now, people have given mouth rinses a bad rap, okay, about destroying the commensal bacteria on your tongue and therefore reducing the amount of nitrites in your mouth. But if you read the studies, you'll find out that generally, matter of fact, almost all the studies show that only chlorhexidine will cause that problem. And even then, there's conflicting results. So the idea that all mouth rinses reduce nitric oxide is wrong. As a matter of fact, it's completely wrong. Not a single one, for instance, showed that Listerine caused a problem with nitric oxide, even though it was tested more than once. So there's very few studies on it. A lot of KOLs out there, that's key opinion leaders, are out touting the idea that you can't use any mouth rinses, and it's completely exaggerated and probably wrong to say that.
So just to summarize, I want you to help with some of the dentists, that young dentists or dentists that we're not focusing on this kind of study. You mentioned that there is some mouth rinse on the market now. They claim that they can able to produce in nitric oxide, right, for the mouth.
The mouth can produce nitrites that are swallowed and enter the bloodstream, and the nitrites are converted in your tissue to nitric oxide. The bacteria on your tongue is needed for that. For that, it's called an endosalivary pathway for nitric oxide production. Most nitric oxide production is done by the endothelial cells in your blood vessels. So the vast majority of it is made that way, but we have compensatory mechanisms in our body to overcome shortages in one area as opposed to another. And also, they've been showing that in some studies that the mouth rinses actually balance your oral microbiome. They do not destroy it. They balance the oral microbiome. So that's another thing I want to dispel the myth of. Okay. Okay.
Wow. Is there some presentation you'd like to share?
No, if you go to my YouTube, I don't have it listed as a public document right now, but I did a 53-minute lecture in New York 3 weeks ago on the enterosalivary system and how it's affected by mouth rinses with all the citations in there. That 53-minute presentation, I can send you the link to it, Locke, and if you want to, and then you can share it with your audience if they want to see it. And I think I did send it to you by text message.
Yes, I did.
So go ahead and share that if you wish to.
It's amazing, Dr. Dow. Like you done dentistry, and it seems like you don't stop there. You are using your knowledge and also scientist skill to build something for the community, not only just for dentistry, but simply this is something that you have a passion to be innovative, creativity, and outside the box thinker. How did you drive that kind of energy? Do you have that passion when you were young, or what drive that kind of passion that you have?
Well, I've always had an interest in science, for sure. But I like this company. These companies that are growing and successful for me are very gratifying. But I have to say that they've been laid into my lap. I have a strong faith in God and Christ, and these things have been laid in my lap, and it's almost miraculous how they come about. I mean, how many people would drive home and have somebody call them up and offer them $400,000? It's to me, that's a miracle that I won't take credit for. I will not take credit for it. There's some kind of direction that I'm going, and I want to, at 73 years of age, I have projects that I want. These are not these are passions, but they're not my ultimate passion. My ultimate passion is to build a clinic in Haiti, to bring people to knowledge and understanding of our Lord, and to bring that message to as many people as I possibly can. That's what I'm up to.
I'm glad you mentioned about your faith. Would you go back to the time 5 years ago? You talk a little bit about how you met a couple of people, and then how did you have a passion, the the drive that you want to build the dental clinic in Haiti for a dentist to study there. Please explain to us, those who follow you.
I owned the practice then. I've been retired for 2 years, but and my partner and I, who owned the practice, we went down to Texas, Wichita, actually, Texas. I think it's called Wichita, Texas. I'm not sure. And there was a company there called buydentalequipment.com. We were going to look at buying new cabinetry for a satellite office we were putting up. And we met the owner of that company, J.W. Oliver. And I found out he was a kindred spirit as far as his Christian faith. And we hit it off really well. He's now a good friend. And he invited me to Haiti to participate in treating children in an orphanage there. So I went. I took my son, and he said he'd have everything ready for me. The clinic would be all set. When I got there, it was not. I couldn't do anything really. I mean, it was no air conditioning. There was no light in the room. The light had to come through a window, and it set people in a lawn chair. Everything was setting up because it was too hot. I couldn't see anything. It was a miserable experience. And I said to him when I left that I won't come back until I have a decent clinic to work in. So that's what we're up to now. We have a building in Haiti that we want to purchase. I put some money down on it already. And we would like to make it a facility that dentists could fly into, get implant training. I have a diplomate degree in many dental implant systems and a lot of experience in implant dentistry. We could train people, send them back home. They could donate their services to the people that need it, get valuable training, and leave. And we think the clinic would be self-sustaining.
It's amazing. So let me ask you a couple of personal questions. So when is that JV, right? JV?
JW.
JW invite you to go. Did you feel like you're ready to go, or you were reluctant to go? And how did your family feel?
I wanted to go. It's like, if you feel like you've been called to do something, you want to do it. So I didn't have any problem with that.
Yeah. So you went there, and that's where you kept in touch with JW, and then things start along. And I'm in the group with you to about building the Haiti clinic. And I see there's so many changes, and of course we still need a lot of collaboration and help from people, and just the timeline and the crisis over Haiti now. It's so much to want us to want to do for Haiti, but it's the situation there is not very favorable.
No, it's very difficult. They've gotten worse and worse. The government is corrupt. The people are suffering, and almost all services have stopped there. They're even having trouble getting water now, clean water, and basic services are just non-existent. There's no centralized electricity, no centralized water, no centralized sanitary services. It's just I've never seen anything like it. When you come back there from there, you're changed forever. It's too difficult, way too difficult. I don't know what to say about it.
So I know one of the reasons that you feel comfortable to come back and support and build that clinic is because you are working with the pastor there, one of the church leader there. So you have an organization that safely can support you to go through this process.
Yeah, that's right. You could support this clinic by going to HOCN.org. It's let me just make sure I spell that right. HOCN.org, and Pastor Caleb, his name is Caleb Lucian, is the one who has been there for 30 years and has built up a fabulous organization. I'm just going to see what I have here. Make sure I spell this right for you.
I will receive that on the text, and I will copy and put on the description of this podcast. That's
Yeah.
why
Hosean is spelled HOSEAN.org. Hosean.
okay.
And Hosean International Ministries, and they've done so many good things there. And you can there's a place on the donation button where you can actually donate to the dental clinic, which would be nice.
How far is that from the main the airport? How far is that?
You mean the clinic from the airport in Haiti?
Yes.
It's about a 10 to 15 minute drive because the roads are kind of slow, but it's not very far. And then I usually fly into Cap-Haïtien, not Port-au-Prince, Cap-Haïtien. And I think they have a better airport, and it's just a little more friendly up there, in my opinion. Yeah.
So you've been to Haiti how many times already?
4 times.
Wow, 4 times. When the last time you were there?
Well, okay, I went there in January to kind of look at building. We looked at buildings to buy for the clinic. Before that, on the second trip I went there, I went with a London agency that builds clinics around the world. Article 25 is their name. It's a charity organization with engineers, and I hired the architectural engineers to build a $17 million clinic.
Wow.
We've scaled that down to $1 million. So the building that we're looking at now is about 5,000 square feet. It will contain somewhere around 10 operatories eventually. And it will have facilities for other medical professions as well. It's a nice building. It's up on a hill, looks over the city, and has a pretty view. And we think it'll be ideal for the clinic.
Okay.
Yeah.
Wow, that's good to know the location that you established. So it's not too far from the airport,
No.
Okay, so that's good. And also, I heard you mentioned that there is some hotel nearby.
Yeah, we have a hotel on the beach. Oh, it's absolutely gorgeous. It's a very modern hotel with a swimming pool. It's exceptional quality, a very exceptional quality, and the view of the Caribbean is absolutely gorgeous. And then they will take you on trips out to an island that is pretty much, there's no inhabitants there, but it's beautiful, and you can swim in the ocean. They'll catch fish. They'll cook it for you. You can actually have a really good trip there. And then the Citadel, which is a historic fort, is located up there, so you can get road trips to the Citadel. It's a beautiful country, and the people are beautiful too.
So that's important because for those of us, dentists, that we want to take adventure and do something that we never done. The way you describe Haiti and the place where you can have an education and also a very nature country.
Fabulous hotel, fabulous beaches, incredible, sea ride, and then fishing if you want to do it, and then the Citadel. There's lots of things to see there, and it's absolutely gorgeous country. You'd think you were definitely in Hawaii or better. Okay.
Wow. Okay. At least give those of us who never experience what you experience.
Right.
You've been there 4 times. I asked my relative, like, you guys, what do they think? Haiti. Everybody worried that if I'm going there. I told my wife I'm gonna go, and she say, well, are you sure? And you mentioned that you've been there 4 times.
Yeah.
That's
it's the nice thing about it is when you go, you're always picked up by Caleb, and he has a very large employee group with his ministry. he has started 35 churches. He has a large school building with 1,000 students in it. And he has gas stations. He's started a number of ministries. They're all, and they have drivers and vans. So they escort you around. You're pretty safe with this group because they take care of you.
Did you say that he had 35?
35 churches he started, yeah.
Wow.
Yeah.
How big is his church now?
I don't know. The one he's in Pinon is a pretty large size. I don't know, maybe 500 or 600 people.
Wow.
You know, I was there. It was a fantastic little church. I loved it. It was beautiful inside. Yeah.
Wow, that's the project that we hope that it's gonna come true.
Me too. Me too.
Yeah. So Dr. Dow, you beside working with these collaboration with those startup company, I know that your routine morning at the retired dentist, what is your routine in the everyday?
I on the line a lot. I have with the Dental Chiropractic Collaborative, like for instance, I just sat here and I have 3 sales on my phone just while we were talking, 3 sales for sleep studies that dentists and chiropractors are ordering. We order sleep studies. We do telemedicine in all 50 states. We teach dentists and chiropractors how to diagnose and refer. And if they want to go into treatment, they can go into another program where they'll actually learn sleep medicine, and we'll train them how to treat as well. Okay.
Wow. And then I know that you this morning you did 16 miles. 16
miles a night. Yeah, I ride every day. I have to get some exercise. So yeah.
That's incredible. That's incredible. So you guys, those of you who are young, still just started the career of dentistry, you see how somebody like Dr. Richard Dow has been practicing dentistry for 5 decades, and how he keep up with the body is exercising. A lot of dentists out there, after the day we burn out, we go home, we tired, and then we just sit around and we gain weight, and so much gaining weight and so much depression, so much stress. Is there any, give us a few wisdom and knowledge or advice, Dr. Richard, in terms of how can a dentist who have a stressful life can have peace in his heart as he go through his life, because not every day is easy day for a doctor or a dentist.
There are stresses out there. That's a hard question. I can just say that what I do is I take time out to meditate and pray and refocus on what's truly important, because I can tell you the problems that you plan for never happen, and the ones you didn't plan for happen. So you might as well stop stressing about that. So I don't have any other than just relax and let go and let him take over. That would be the way I do it.
So you start your morning with reading the Bible verse?
I do that in the evening. I'm not terribly good at the morning. I do my meditating and praying while I'm riding my bicycle. I spend that time, being careful, of course, but I do, that's my meditation and prayer time.
Wonderful.
Yeah. It goes well together.
Yes. As you enjoy nature and you appreciate what the creation that you created by the creator. Yeah. Dr. Richard Dow, it's been a pleasure to quickly just have a conversation with you. Keep it up with the date that you're doing. I really want to follow back again every time your project is coming along. That's where we can spread the news around for this generation of dentists who really need to adapt to technology and new product out there. Like you said, the Listerine or chlorhexidine has been in the market so long. Toothpaste have been in the market so long.
Yeah.
And after a while practicing dentistry, we need a breakthrough. So I thank you for your
Thank you.
innovation and your development of this product that is going to be awesome for new generation, Dr. Richard.
Thank
Richard, really again appreciate you on the show today. You have a pleasant day.
you too. Thank you.
Take care,
Appreciate it.
sir. Thank you, sir. Take care.